Now for the big antidysrhythmic drugs. We have 4 main classes and a few other sections. So let's do a quick overview and then we'll go into more detail in a moment. So starting at class 1 here, sodium channel blockers, we have procainamide and lidocaine, mainly given for deadly ventricular rhythms like VTach and VFib. So anything starting with the V, just think very deadly, since cardiac output is affected heavily. Basically meaning low cardiac output, meaning low oxygen out to the body. Now class 2 is beta blockers ending in LOL, like propranolol. So just think the double L's means double lows, lower heart rate and lower blood pressure, mainly given for hypertension, atrial fibrillation, and atrial flutter. Now class 3 is our potassium channel blockers, and the drug of choice is amiodarone, mainly for ventricular dysrhythmias like VTach and VFib, which are very deadly. Now they help to calm the rodeo-like rhythm, so just think amirodeo for amiodarone. Now the last class here is class number 4, calcium channel blockers. Just think that calcium channel blockers calms the heart. So we have verapamil ending in mil, so just think calm and chill. And diltiazem, just think Zem is like Zen yoga for the heart, very calm. And nifedipine, just think D-pines decline the heart, mainly given for hypertension, atrial fibrillation, and a flutter. Now if you notice, all the names end in blockers. So consequently, they all lower blood pressure, causing hypotension. So just think blockers block and lower the blood pressure. So a big side effect here is hypotension, and you must reassess the blood pressure every hour. Now the key point here is the dizziness. We have low blood to the brain, mentioned by 4 different question banks. So low blood pressure, think low oxygen to the brain. Typically it's the first sign. So a big key point for teaching is teach slow position changes. Huge NCLEX safety tip to prevent falls. Any drug that lowers the blood pressure lowers perfusion to the brain. So a memory trick, just think when the BP is low, you gotta go slow. So we must teach slow position changes. Now other drugs given for dysrhythmias, we have adenosine, which decreases the heart rate, given for a super fast heart rate called SVT. So think you put the heart down into a fox den for a adenosine, basically decreasing the heart rate. Next is digoxin, our cardiac glycoside, given for atrial fibrillation. So just think digoxin, digs for a deeper contraction, lowering the heart rate, but not the blood pressure. So no orthostatic hypotension, but we do have to check the apical pulse for 60 seconds prior to giving. Now the bad news is that digoxin is a toxin, so you must keep that range under 2.0 and monitor for nausea and vomiting, as well as visual disturbances. Now the last one here is atropine, or atropine, given to increase the heart rate for symptomatic bradycardia, basically meaning clients with a low heart rate below 60, who show signs of low oxygen, like mental status changes, or even pale skin signs like cyanosis. We push this medication to make the heart rate go crazy high. So think atropine puts the heart rate on top of a pine tree for atropine. Just a really, really high heart rate. Now I know that's a lot to remember, so let me just show you a few more memory tricks for the most tested key points for your exams. So for your antidysrhythmic memory trick, just think ABCs are on top of the heart, affecting the atrial rhythms, affecting the SA node and the AV node. And LAP sits in your lap, since these drugs affect ventricular rhythms. So starting with A, B, C, and D for atrial rhythms. We have A for atropine and adenosine, B for beta blockers, C for calcium channel blockers, and D for digoxin. We'll break these down in a moment. And for LAP, for the bottom, these guys sit in your lap on the bottom for the lower heart, since they're typically given for ventricular rhythms. So L for lidocaine, A for amiodarone, and P for procainamide. So let's break these down one by one. Starting at the top, we have A for atropine and adenosine. Again, atropine puts the heart rate really high on top of a pine tree. Again, given for key terms, symptomatic bradycardia. We have a low heart rate below 60 with signs of low oxygenation. Now, the first signs of hypoxia here, or low oxygenation, is mental status change like confusion or agitation, and late signs are cyanosis, like purple and blue lips. So the goal here is to restore normal heart rhythm. Now, a very common test question here, and even an NCLEX question, talks about giving a client atropine and then giving you 4 strips asking which is the desired outcome of atropine. Now, you always want to choose the normal sinus rhythm. So always count the R peaks here. So right here we have 8 R peaks. Now 8 times 10 gives us 80. So that's perfect. Normal rhythm is between 60 and 100, so 80 is fine, and the R peaks are evenly spaced apart. This is our normal sinus rhythm. Now to adenosine. Adenosine decreases the heart rate, like putting it into a den or downstairs for adenosine, you see? So it's given for SVT, that super fast heart rate. So the key point is that we give it fast. IV push in 1 to 2 seconds. So write that down. Big NCLEX tip. And we always flush with saline immediately after. Just slam the flush. Since it wears off in about 5 or 10 seconds, we have to give it quickly. This key term showed up multiple times on 3 different NCLEX question banks, so we always push the den in 1 to 2 seconds. Now the big key point here is this rhythm. This is SVT. You have to know on the NCLEX when to give adenosine. So see how fast it is? The NCLEX expects you to know this deadly rhythm, which we cover all the top 9 NCLEX rhythms in another video. But go ahead and pause the screen right here because you have to know SVT with adenosine. Next is beta blockers, which puts the brakes on the heart by blocking beats to lower both the heart rate and the blood pressure, ending in LOL. So think 2 L's for 2 low cardiac vitals, low heart rate and low blood pressure. This is given to slow down hypertension and put the brakes on fast rhythms like SVT, tachycardia, and even AFib and A-flutter. Now the key side effects to know is obviously low blood pressure and low heart rate. So we always hold for any type of low blood pressure or low heart rate under 60 beats per minute. Another big side effect is bronchospasms and bronchoconstriction, like wheezing or dyspnea or difficulty breathing. So we always avoid asthma and COPD patients, but we cover that in our full beta blocker video. So a common question, which drug is causing this rhythm? So look at the R peaks here. We have 5 R peaks, so that means 5 times 10 is 50 beats per minute. That's way under 60. So the answer is propranolol, ending in LOL, so that's how you know it lowers the heart rate. Now for calcium channel blockers. Think calcium channel blockers calms the heart. Since we say calcium contracts the muscles, when calcium is blocked with calcium channel blockers, we get more calm. Now this is given to lower both cardiac vitals, heart rate and blood pressure. So think of the C as a couple, both heart vitals. So we get lower blood pressure as well as lower heart rate, given for hypertension, atrial fibrillation, A-flutter, and SVT. Now once again, the memory tricks. Verapamil ends in a mil, so think calm and chill. Diltiazem, think Zen yoga for the heart, calm and relaxed. And nifedipine ends in D-pine, to decline the heart rate. Now it doesn't end in pine, it has to be D-pine. So don't let the NCLEX trick you here. Pine is for atropine or atropine, to put the heart rate really high, like on top of a pine tree. And D-pine declines the heart. Now for 3 common questions here. Question 1, intended effect for diltiazem. The answer is ventricular rate is decreased from 160 to 70. Yes, remember it ends in zem for diltiazem, so think zen for the heart, calm and relaxed. Question 2, Priority adverse effects to watch for when giving amlodipine. And the answer is dizziness, since D-pine declines the blood pressure, aka lower blood pressure. So think low blood pressure, low blood flow to the brain, clients get dizzy. And question 3, most important patient teaching when giving verapamil. We have to think calm and chill, heart rate and blood pressure here. So the answer is slow position changes. Again and again, the memory trick is the same. If the BP is low, then you got to go slow. So just think any drug that can lower the blood pressure, we have to think low blood flow to the brain, causing that orthostatic hypotension and dizziness. Always, always, always teach slow position changes. A big key word. Now D is for digoxin, which digs for that deeper contraction to help the heart contract more forcefully. It also decreases the heart rate and not the blood pressure. So no need to go slow for position changes. And it's given for atrial fibrillation as well as heart failure, where we have a weaker heart pump. Now the main side effect for digoxin is toxicity. So we call digoxin the toxin. Now the max range to know for the NCLEX is 2.0. And the first signs of toxicity is, write them down, number 1, anorexia, number 2, nausea and vomiting, and number 3 is vision changes. So you'll probably get a question about a client on digoxin having difficulty reading a book or some type of vision problem. This question wants you to think toxicity for vision changes. Now another common question, a client on digoxin with history of renal failure. What's the key lab to monitor for? And the answer is creatinine. Just think creatinine over 1.3 is a bad kidney, since the kidneys filter the blood from toxins. Broken kidneys means a broken filter, leading to a higher risk for toxicity. So just watch out for those key terms. And lastly here, since digoxin decreases the heart rate, our key sign to report is dizziness and lightheaded, which could mean bradycardia. Now you'll see a strip like this showing bradycardia less than 60 beats per minute, asking, would you still give digoxin to this patient? Well, ask yourself here, is digoxin going to lower the heart rate even more? Well, yes. So obviously, no, you have to hold any medication which will decrease the heart rate more. Now, we cover all the other key points for digoxin in the full digoxin video, so please go there to see the complete drug. Okay, now switching gears to the bottom of the heart, the lap, for our ventricular drugs, since these ventricles are low like your lap. Again, mainly given for those deadly ventricular rhythms like VFib and VTach. So again, just think anything starting with the V is very deadly, since it affects the big mama ventricles that are responsible for all the cardiac output, meaning all the oxygen out to the body. So low cardiac output means low oxygen out to the body. Now L is for lidocaine. It ends in cane, so just think cane calms the ventricles. For VTach and VFib mainly. But it can also work for SVT, atrial fibrillation, and a flutter. But that's commonly not tested. The real big key point here is the adverse effects. It can calm the heart too much, leading to hypotension, a really major side effect for all LAP drugs here, and lidocaine toxicity. Any neuro change is the first sign of toxicity. So write this down, neurochecks are priority. Now, it has a very short half-life, meaning that it only lasts a short while inside the body, so it can be easily treated if we have toxicity. Next, A is for amiodarone. This is our second drug that's typically recommended only if lidocaine does not work. Now, this is because it has life-threatening toxic effects. The key point here is, write it down, pulmonary toxicity or lung toxicity. We see a dry cough and dyspnea, difficulty breathing while ambulating, as well as shortness of breath. Now, these are the key terms that are priority and need to be reported immediately, or the patient could die. Now, this drug is given to slow down crazy ventricular rhythms. So the memory trick again, amiodarone, think rodeo. It slows down crazy ventricular rhythms to stabilize the heart. And the rodeos can be super dangerous and people can get hurt. So amiodarone is dangerous too from all its toxic side effects here. Now, some expected side effects is the low blood pressure and low heart rate. Again, it goes for all LAP drugs here. So amiodarone has negative chronotropic and negative dromotropic properties. Chronos meaning time, so negative chronos means less beats per minute. It lowers the heart rate. And dromo, just think drum beats or electrical impulses here. Negative dromo, we have less electrical impulses, which means less drums, or a more rhythmic beat that's more stabilized. Lastly, we have P for procainamide. Again, it has the word cane in it, so think cane calms those ventricles, just like lidocaine. But this drug is becoming less and less popular in the hospital setting, and therefore it's not commonly tested. Now lastly, don't let the NCLEX trick you here with the A drugs. Atropine, amiodarone, and adenosine. All start with A and sound a little bit similar, so the memory trick is to think of a stoplight. Now, it's not a perfect memory trick because the green light is on top. Well, you get the idea here. But the memory trick here, green light on top for atropine, green like a pine tree. The heart rate goes really high, like on top of a pine tree for atropine. Given for symptomatic bradycardia to speed up the heart rate. Now yellow is for amiodarone, which slows down the ventricular heart rate for VFib and VTach to stabilize those crazy rodeo-like rhythms for amiodarone. Now red is for adenosine to stop the fast heart rate in SVT and get into a normal sinus rhythm. So think aden, since aden is downstairs, to make the heart rate go low with adenosine. Now the top missed question here. Which drugs do we teach slow position changes due to orthostatic hypotension? So just think here, any drug that can lower the blood pressure. Now it's easier to choose the drugs that don't lower the blood pressure here, like digoxin and atropine. All the rest can lower the blood pressure. So starting at the top here, number 1 is atenolol. Remember, double L's for double lows, lower heart rate and low blood pressure. Number 3 is amiodarone here. Remember, it stabilizes the rodeo-like rhythms for amiodarone, dropping the blood pressure. And amlodipine ends in dipine to decline the heart, so low blood pressure. And diltiazem is like Zen yoga for the heart, lower blood pressure. And lastly, we didn't cover it, but furosemide is an ide-ending diuretic, so it ends in ide. Think the body is dried. Once we let fluid out of the body and into the potty, we lower the blood pressure. All right, that wraps it up.